All right. Hi, everyone. My name is Alycia Bayne. I am a researcher, a public health researcher and evaluator at NORC at the University of Chicago. And if you've never heard of us, we're a 76-year-old social science not-for-profit research organization. We're affiliated with the University of Chicago, but we're our own entity. And I work within our public health research department. I've spent the past 12 years there doing rural health research within a unit of our department called the Walsh Center, which focuses on health disparities in rural communities. So I'm happy to be here today to share the rural perspective, specifically looking at access to transportation. And I'm going to talk about a project that we did for the Federal Office of Rural Health Policy. So I'm going to start off today by talking a little bit about rural communities, giving a little bit of context. I'm going to tell you about the toolkit that we developed, and I'm going to share some examples of transportation programs in rural communities that are serving older adults and addressing some of the challenges that we are raising today. I'm also going to talk about some lessons learned from these programs and some implications for our work here. So depending on what definition you use, somewhere between 17 and 20% of residents reside in rural areas that comprise about 80% of the US landmass. Rural communities are incredibly diverse. They're not small urban communities. They have diverse geography, culture, history, demographics, and unique assets. Some of the strongest assets are the people that live within rural communities. There's a strong community engagement, a strong sense of civic engagement, strong partnerships, because people are forced to do more with fewer resources. People often wear multiple hats. There's also a sense of resiliency and adaptive capacities in rural communities. The challenges are numerous. There's a higher poverty rate in non-metro communities, lower educational attainment, increased health risks related to chronic disease mortality rates, higher rates of injury, substance use, and suicide. And there are fewer services available. These include health services, access to specialty care services, housing, and of course transportation. This is a look at older adults in rural communities. So on average, rural populations are older in rural communities. This is from the American Community Survey. And populations of older adults increase by level of rurality. So the dark bar shows the most rural communities, your non-core communities. So that's 19% of the population in comparison to the nation, which is about 14.5, over 65. This is what the population looks like by county across the US, that's over 65. So your darkest blue counties are where you see more than 25% of the population over 65. And then your darkest green counties are your non-metro and micropolitan communities where more than 25% is over 65. So I think it's just a nice kind of visual to see what we're talking about. The ability to age in place is largely dependent upon access to transportation, which we've been hearing about today. And over 90% of passenger trips in rural areas occur by car. And I think that makes sense if we think about it, compared to about 84% of trips in urban areas. But it presents a huge challenge because most people will outlive their ability to drive. And so what do you do when public transit is incredibly limited, or in some rural and frontier communities, it's non-existent? And that's a huge challenge. There's also a lack of resources in rural communities to improve public transit. There's a lower population density, which means a lower tax base, and also lower ridership for fixed route services. There are longer travel distances to reach different services. On average, it's about 9 miles longer to reach a doctor or a dentist in a rural community. And that's far when you're talking about somewhere you may have to go every day or several times a week. There are safety and infrastructure issues. I think the Federal Highway Administration estimates about 40% of rural roads are inadequate. And then the issue of geographic isolation, which is connected to social isolation, which we heard about today, and loneliness, which then increases your risk for depression and even heart disease. There are higher rates. So I want to tell you about a project that we are doing for the Federal Office of Rural Health Policy, which is within the Health Resources and Services Administration of HHS. It's called the Rural Health Outreach Tracking and Evaluation Program. It's funded by the Federal Office of Rural Health Policy and conducted by us at the NORC Walsh Center in partnership with the University of Minnesota Rural Health Research Center. And essentially what we've been doing over the past decade is identifying evidence-based and promising models in rural communities on different community health topics. And then we build evidence-based toolkits that can help rural communities and practitioners within rural communities access an evidence base and build a program, so you're not constantly reinventing the wheel. This has been a huge challenge in rural communities because a lot of the research does not make it into the published literature. So we really dig up a lot of these examples and are learning from the rural communities. Transportation is one of 16 toolkits that we have right now, and we've had over 1 million page views of our toolkits. So just briefly, our methods, the federal office selected transportation as the topic to focus on in 2016. I was thrilled that they were interested in this because through all of my travel to rural communities and my research in rural areas, transportation is probably one of the most frequently cited barriers, regardless of the topic of the project that we're focusing on. So it was really fun to be able to focus on this. We reviewed applications of programs that are funded by the office, and we also reviewed the literature and tried to identify programs that are in the gray literature as well. We conducted interviews with programs and experts to learn about their experiences, and we developed a toolkit and an issue brief, which will be out this month. We also conducted a public webinar back in February. So I just want to note the toolkit was it was designed to focus on all populations, not just older adults, but I'm going to try to share some examples and some findings that are really specific to older adults. So this is where you can find the toolkit. If you go to ruralhealthinfo.org, we work with the folks at the Rural Health Information Hub. It is, as they say, your first stop for rural health information. It's a great resource. You can find anything there from is my community really rural to all types of guides and resources and toolkits. So this is what the toolkit looks like. On the left, you'll see there are modules. In the second module, this is what I'm going to be talking a little bit more about. These are program models that we identified in rural communities, and I'll be giving you a few examples of those, but there are so many more in there I won't have time to share. And then there are resources and narrative related to, how do I implement a program? How do I evaluate it? How do I disseminate it? And how do I think about sustainability? So this is really a tool for rural communities. We've identified models in 3 different areas. So how to improve access to transportation in rural communities, how to overcome barriers specifically related to reaching healthcare services, and then finally improving safety or infrastructure. So I'm going to talk about just 3 examples of models that we identified in rural communities that are being used. And I'm going to give you examples of programs that are focusing on implementing these models for older adults and then what they learned. The first model is the volunteer driver model, and I'm sure many of you are familiar with this concept. Basically, a passenger requests a ride to go from one location to another. It may be for a medical appointment or to reach the grocery store or to see a loved one. These programs in rural communities may be exclusively offered for older adults. They may be offered for people with disabilities or for a specific geographic area in a community. And drivers provide door-to-door services, door-through-door services. Sometimes they actually go into an appointment with someone and help them in the appointment. They may provide help with packages. And drivers in the volunteer model often use their own vehicle. They may be reimbursed for their mileage, for their time, or for trip banking, which means that they can use the service at a later time. Often in rural communities, passengers are required to schedule a ride 24 hours in advance to make sure that the volunteer is available. So this is a challenge. And then it's certainly dependent upon the availability of the volunteer driver. So I'm going to give you an example. So this is an example of a volunteer driver program. It's the Center for Independent Living for Western Wisconsin, and they cover about 57% of their population in Wisconsin. They serve a frail, elderly, and also people with disabilities in a 28-county area. This is a very rural community. I think it's about 3 times higher than the national average in terms of rural residents. They serve 3,000 riders, and the leader that focuses on this program, that implements it, talked about that this program is absolutely necessary in every county that it serves. There isn't another option for transportation. They have a call center staffed by specialists that coordinates with organizations throughout these counties and can get each person a ride. And then volunteer drivers are reimbursed for miles or through a voucher program. So this is just one of many, many different types of programs. The second model I want to talk about is the voucher model. It subsidizes the cost of transportation for riders. And it's interesting because it can also incentivize transportation providers to work together as part of a network in the community. The way it works is that riders, if they're participating in the program, have a ticket or a coupon that they can use in exchange for a ride. And eligibility for that program is often determined by the program that's implementing it and the sponsoring agency. So maybe you have to be a certain age, or you have to potentially be someone who has a disability or is unable to use other services. It may be based on your location. The providers that participate in voucher models may span anywhere from a volunteer driver program, taxi services, if there are any taxi cab services in the community, agency vans, or even volunteer drivers. And then after the passenger uses the voucher, they submit it, and then the taxi or whatever service it is submits it to the program for reimbursement. So here's an example of a voucher program. It's the Living Independence Network Corporation. This is in Twin Falls, Idaho. I think about 30% of the population served here, or that lives here, is in a very rural area. And participants travel for a discounted rate. So it's not free, you have a copay, but it is a reduced cost to ride. And it helps people who are 60 and over and people with disabilities. And shopping is the #1 destination, so it's not purely for medical appointments. And they have about 500 riders, 70% older adults. And if you're interested in more about these programs, I'm happy to share more. The third model is the ride-sharing model, and ride-sharing means a lot of different things, or it can mean different things. It can mean vehicle sharing, where an organization shares a vehicle with another organization during different points in time. It can be carpooling or van pooling, where people use transportation for a common destination. Or it can be real-time ride-sharing, which is what we're thinking about now, is the Ubers and Lyfts, where it's happening perhaps with GPS or with a smartphone or the internet. These services may be for-profit or not-for-profit. They may use volunteer drivers. They may be designed to serve all populations or specifically older adults. And it's a promising model because it's been shown to potentially increase mobility and quality of life for older adults. I'm actually not going to share an example of this program because you'll be hearing about it tomorrow. Catherine Freund will be talking about ITN America, which I think is a great example of ride sharing. So what did we learn? Here are some lessons learned specifically from programs focusing on older adults. The first is really important. So every rural community is so different, and we could say that about any community. And so a program that works in one community is not necessarily going to be able to work in another. And the reason we developed the toolkit the way we did is that you can lift these models, you can combine them, you can use pieces of them that will work in your community. And so it's important to keep that in mind. It's also important to partner in the community with existing transportation providers. And this is something we hear about a lot. Rural programs are not meant to replace something that already exists. They want to partner and complement whatever infrastructure, whatever services are available. There's a need for accessible vehicles, which I think came up earlier today, especially in rural communities where maybe there's one ADA accessible vehicle and it's only offered Monday through Friday until 5 o'clock. And so what happens if you need to get a ride after that time? It's important to increase awareness of transportation programs. So just because they're there doesn't mean that people know about them or feel comfortable using them or know how to use them. And so that is a key issue, especially because a lot of these programs don't have funding to really do like a lot of education or marketing. Some programs are actually carefully pairing the rider and the driver, which I thought was really interesting. When it's possible to do that, they found that you're actually building a really trusting relationship between a driver and a rider, and it increases satisfaction for the program. Another thing is that it's actually challenging to find funding for transportation beyond healthcare. So sometimes it's easy, not easy, but you can find funding to help people potentially in a model get to a healthcare appointment. It's harder to fund a program when you're talking about helping people connect with loved ones or engage in social activities. And then finally, one program leader said it best when she said, life does not stop at 4 p.m. Monday through Friday. It's important to give people the most independent and high quality life and ability to get around that we possibly can. Some implications for our work. I think it's important to think about social isolation, which we are, and we've been talking about loneliness, and I think that's critical to identify opportunities to reduce social isolation in rural communities, especially when you have that added layer of geographic isolation, specifically looking into frontier communities. It's important to measure the impact of transportation programs. It's very difficult anytime you're measuring quality of life, cost savings, return on investment. It's challenging to do that. It's even more challenging to do that in rural communities where there may not be as much data, there may not be funding for evaluation, although there is funding for direct services. So that's something I'm really interested in and passionate about. I think it'll be important to study the impact of emerging technology and automated vehicles on what that means for access for older adults in rural communities. Will these technologies reach rural communities? What will that look like? And then finally, exploring ride sharing as a promising approach. And I just want to briefly mention a study that we are working on with, NORC is working on with IT in America and Catherine Freund. We are conducting a study for the Centers for Disease Control and Prevention, and we are looking at identifying barriers and facilitators of older adults' use of rideshare services. We are partnering with several rideshare services, including Lyft, GoGo Grandparent, ITN, and then also services in rural communities. And we're going to be conducting focus groups and interviews with older adults and younger adults, so we're going to compare the age groups. We're also going to be talking with users and non-users of services to understand their attitudes and beliefs related to ride sharing. We're also conducting an environmental scan of all services in the US that are available for older adults. And this is going to be in rural and urban communities. I want to acknowledge the contributions of the team that developed this toolkit and leave my contact information if anyone has questions. Thank you so much.
Any questions? Very rudimentary question. Maybe most people know the answer, but I don't. If somebody volunteers for a ride-share service, what happens if they get in a crash? Is insurance for somebody's family car going to cover this? How does that work?
So insurance is actually one of the biggest things that these programs are thinking about. I think it depends on the program, and I know that that is kind of like a barrier to startup for these programs, making sure that you have the right insurance in place, understanding what the scope is of insurance. They do a lot of background checks on drivers. There is amazing amounts of training and education that some of the programs have for drivers, from everything from being able to notice if there's abuse, to human trafficking, to how to deal with somebody who's having a medical emergency while you're driving. So these are all liability issues that programs are dealing with.
Yeah, I just wanted to ask a wonk type question, which is how did you get your focus groups in rural communities? We're trying to do work where we're trying to get access to people who are socially isolated. And of course, they're the ones who don't come out to the health fairs, they don't come out to community events. So I was curious how you formed your focus groups.
It's a good question. So for the toolkit, for the study that I was talking about, we relied on interviews, and the interviews were with program leads. And that was because of the methods, and that we were not able to go through the process of OMB clearance, which you have to do if you speak with more than 9 people. But for the CBC study that we're doing, we grappled with that issue of focus groups. How would we do it? How would we do it in a cost-effective way? And we actually are going to be doing interviews, extensive interviews with a rural population. We're not doing focus groups because it just wasn't in the budget for that reason, yeah. Okay, well, thank you so much.
Thank you.